Vanakkam. I am sure you all agree with me if I say that the motor skills in the hand are amazing. But what if I told you there is something even more amazing than these motor skills? The way these motor skills develop in the growing baby. And that too, imagine, most of these skills develop within the first 2 years of life. Isn't that fantastic? Okay, the way these hand skills develop in the child may be amazing, may be interesting, may be fantastic. But why should we as surgeons know about them? We do need to know about them because we are going to operate on the hand of the baby that has not yet developed motor skills, on the hand of the baby that is still developing these fine motor skills, and we need to be careful. So first we need to know what are the skills that develop and how they develop, which is what we are going to see in this video. It is amazing how the hand develops such fine motor skills. It is all a process of the normal growing hand after birth. In this video, we shall see the different aspects of growth of the hand and why we should know about this. Perhaps the reason why we should know about this should be dealt with first. As people, as doctors and as surgeons who are going to take care of the hand, who are going to operate on it when needed, and making sure it works well, we need to understand when and how the hand motor skills develop in the baby. If we operate on the growing hand without understanding how it develops, we may be going against nature. And trying to go against nature may not only result in poor function, it may also hinder normal development. For instance, if a child with grade 5 hypoplasia of thumb presents at 6 months of age and we are planning a microvascular toe transfer for the reconstruction of the thumb, the questions that will arise in our mind are, will it work? And if it does work, what is the sequence in which the normal development will occur? So we need to know three important things. The first is, what are the developmental theories of hand skills? What factors affect hand skill development, and what are the actual hand skills that develop from birth to 2 years of age. There are many developmental theories of how these hand skills develop in the babies. The most popular is the neuromaturation model, which is one of the early theories of motor development. In this model, the central nervous system control over the motor performance of the hands is most important. There is an orderly sequence of motor development stage by stage that could be observed in every typically developing child. And this has been described by McGraw as the typical progression of maturation, in which first we have the dominant reflexive responses in the hands, following which there is an inhibition of these reflexes which comes down slowly and transitional behaviors start occurring. Finally, there is voluntary motor pattern and skill development, in which the child is able to control what it wants to do with the hands. So when cortical control begins to dominate over the subcortical control of hand movement, voluntary grasp emerges. By 4 months, the infant grasps a visually located object. When we examine the brain of the growing baby, we find that the number of neurons is the same. It is only new synapses that are being formed according to the skill development, and the synapses that are no longer used get pruned. And what factors affect these hand skill developments? Hand skills emerge through the interaction of systems: the motor system, the sensory system, the perceptual system, skeletal, psychologic, visual systems, and so on. All these systems interact with each other and the environment to provide the basic motor skills. These systems are interdependent and work together such that strengths in one system, example the visual system, can support limitations in another, example kinesthetic system. For example, In trying to reach to pick up a cup, initially it is guided by the visual system, but after practice and learning, it is guided primarily by the kinesthetic system with some direction by the visual system. In contrast, grasping appears to initially involve primarily somatosensory input, but later also is guided by vision. Early grasping and manipulation patterns that are guided by visual and somatosensory input, like playing with a rattle, are later guided by cognition and memory, like for instance handwriting. The basic pattern of skill development is as follows. First, the sensory systems develop, like the visual system, the auditory system, tactile system, etc. Then, the gross motor skills like postural control, stability, muscle tone and strength develop. The fine motor skills develop next, like bilateral coordination and dexterity of the limbs. The next skills to develop are the self-care skills like toileting, grooming and dressing. Finally, life skills develop. This is the outline of development of skills called the developmental progression. All these skills are based on neuronal synapses that occur. As we have seen, the maximum development of these synapses occurs up to 2 years of age. Up to this time, it is said that about 700 synapses develop per second. Before studying the actual skills that develop in the baby, we need to remember that movements are present in the fetal hands even before birth. But these are general movements that are noted in the prenatal period. In this period, we may have early spontaneous movements that can occur from 8 to 36 weeks in the prenatal period, or writhing movements from 36 weeks in the prenatal period, which may persist for up to 8 weeks after the baby is born. Some of these spontaneous movements and the writhing movements can be seen in this animation video, which shows the generalized movements of the hands and upper limbs. Once the baby is born, hand skills must develop for functional outcomes. And as far as the hands are concerned, there are 3 categories of movements that must develop: grasp, release and bimanual movements. First, let us see how the all-important movement of grasp develops. This is otherwise known as the prehension movement. As in the development of any hand skill, grasp also first starts off as a reflex movement known as the reflex grasp, then it is followed by a transitional grasp, and finally the purposeful grasp or the voluntary grasp. First, let us consider the reflex grasp. In the first couple of weeks of life, usually the grasp reflex has not yet emerged. By 4 weeks, the grasp reflex can be elicited with a contact stimulus to the palm or fingers of the baby. A moving stimulus is most effective in producing this local grasp reaction, which is immediately followed by the traction response, that is, of adduction of the shoulder. By 8 weeks, 2 distinct phases of the grasp reflex are observed. The first is the catching phase, which is an immediate flexion of the fingers and thumb, and the second or holding phase, in which the finger flexion is sustained. By 3 to 4 months of age, a true grasp reflex has developed, and the traction response no longer automatically accompanies this response, although dorsiflexion of the wrist continues to accompany the finger flexion. This video demonstrates the grasp reflex, where the infant's fingers flex around the finger or the object and hold on tightly. In fact, if both fingers of the examiner are used, the infant can be lifted with this grasp alone. These reactions are nothing but physiological substrata for increasingly complex forms of voluntary prehension which are going to develop as the infant matures. This reflexive grasp stage is going to move into the transitional grasp stage now. This grasp reflex becomes diminished by around 4 to 5 months of age, and fractionation of this grasp reflex begins. By that we mean that 1 or 2 fingers flex in isolation from the others, given specific stimulation of their volar surfaces. By 5 to 6 months, an instinctive grasp emerges which combines the fractionated grasp and the orienting response. The instinctive grasp is a transitional behavior between the primitive or reflexive grasp and the mature pattern of grasp. This is because the fractionated movements of fingers and hand come under the infant's voluntary control. After this, the stage of purposeful grasp begins. Between 4 and 6 months, the infant develops control of grasp. Using both tactile and visual information, the infant becomes skillful in adjusting the hand to the object. At around 20 to 24 weeks, the squeeze grasp develops. In this grasp, the infant presses the cube using total finger flexion against the palm. The thumb does not actively participate in this grasp and tends to lie in the palmar plane. So the grasp has officially started developing, but it has to mature. The 4 to 5 month old infant often is seen scratching, that is, alternating finger flexion and extension of the digits together. This scratching motion allows the infant to practice the full range of reciprocal finger flexion and extension. Scratching also provides the infant with rich tactile information about different textural surfaces. Rubbing of the hand on the surface as an additional method for obtaining tactile input in the infant is seen at around 16 to 28 weeks. The next stage of grasp development is the development of the palmar grasp. We are going to see what this palmar grasp is and what is the significance of this palmar grasp. By around 24 weeks, the pronated hand and flexion of all fingers around the object can be seen. The thumb may slide around the object again passively rather than actively holding it. This is the classical palmar grasp. At 28 weeks, thumb opposition first appears. It is used only with the palmar grasp. The infant holds the object in a radial palmar grasp, otherwise known as a superior palmar grasp. This radial palmar grasp is a hallmark in grasp maturation because the infant now differentiates the sides of the hand, using the ulnar side to provide stability for the grasping movement and the radial side to prehend and hold the object. This early pattern signifies the initial development of the radial fingers as the skill side of the hand. The object can be brought to and put into the mouth, banged against another surface, and the object becomes accessible for object transfer from hand to hand. Between 32 and 36 weeks, the infant demonstrates grasp of the object in the fingers rather than the palm, and by 36 weeks, the infant exhibits a radial digital grasp. In the 36-week-old infant, first raking movement of the fingers can be seen. That is, the hand is stabilized on a surface during this grasp and the ulnar fingers are flexed to provide stability of the thumb and radial finger movement. The infant then grasps a very small object like pellet size with a scissors grasp, which is defined as prehension of a small object between the thumb and the lateral border of the index finger. The forefinger grasp or the inferior pincer grasp is observed at 40 weeks. This is a fingertip grasp in which the infant stabilizes the forearm on the table as a base while grasping the cube. The fingers that prehend the small object are more extended than flexed. So this is the inferior pincer grasp. By 52 to 56 weeks, the infant prehends and holds the object between the thumb and the forefinger tip, and this is achieved without forearm stabilizing on the surface. So now the infant's hand is ready for a play activity or as a tool because the infant no longer needs to stabilize to grasp. He can easily prehend objects from a variety of surfaces. This is otherwise known as the superior pincer grasp. So around 1 year of age, the infant takes less time to prehend an object. By 60 weeks, prehension becomes deft and precise. The child can move different parts of the hand that is the radial and ulnar sides independently and can control the action of isolated fingers. By 18 months or 1.5 years, there is a good opposition of the thumb and greater grasp control. And finally, by 2 years, there is an increasing dissociation of the fingers, strength, and control of the hand's arches. So, functional skills like self-feeding, using a spoon, scribbling with a crayon, or turning the pages of a book can be done by the child. Along with the development of the grasp movements, it is important for release movements also to develop for useful function to result. Release is an integral part of prehension and manipulation. It involves extensor movement patterns, so it has a different developmental trajectory. The object release movement matures after early grasping patterns are achieved. And for this movement to occur, it requires inhibition of the flexor muscles with contraction of the extensors. So it needs a more mature neuromotor pattern. By 3 to 8 weeks of the infant's life, automatic release is seen. It is sometimes known as the avoiding response. When the dorsum of the hand is touched, the fingers abduct and extend. This instinctive avoiding response is seen more between 12 and 20 weeks and seen more commonly when the child is irritable. So long, it has been reflexive release patterns. From 5 to 6 months, the infant begins a transition from reflexive to purposeful release. The infant demonstrates release accidentally or involuntarily in association with movements, tactile stimulation to the hand, or contact with another surface. Between 40 and 44 weeks, the infant demonstrates purposeful release in the context of play. The first active release is often accompanied by flinging the object, combining elbow, wrist, and finger extension in a synergistic ballistic movement. The infant now purposefully drops food and toys from his or her high chair and takes great pleasure in practicing this newfound skill. The object is released with the hand above the table surface using full finger and thumb extension. By 52 weeks, the infant demonstrates greater proficiency in releasing the object with increasing control of finger extension. So there is a graded hand opening when releasing or extending the fingers. By 18 months, stabilizing the proximal hand or arm part on a surface to accomplish controlled release is still needed. But this requirement comes down slowly and arranging cubes like a tower can be done, and here visual inputs are important. An extension of fingers can occur with a suspended arm. By 2 years, well-developed internal proximal stability and smooth graded or incremental release patterns are seen. For instance, for the child to be able to fit puzzle pieces into their form space, or place small objects in a container, or turn pages of a book smoothly. These hand movements of grasp and release occur in both hands. At the same time, there begins a coordinated movement between the two hands, and this process is also quite interesting. Human beings are essentially bimanual beings from birth, and most movement patterns of the arms and hands involve combined movements of both sides. In the neonate, both symmetric and asymmetric limb movements are seen. By 3 months, we see this characteristic swiping movement. This swiping increases and hand-to-hand interplay is observed with hands clasped to the chest. At 16 weeks, the hands join together at the midline, sometimes with an object held between them. Once the object is prehended, the infant usually brings it to the mouth or the chest. At 5 months, the infant reaches for the object with two hands but uses only one to grasp. The second hand may support the first. After the grasp is achieved, and often both hands bring the object to the mouth or hold it in space for visual inspection. And by this time, inter-hand transfer has significantly increased. By 24 to 28 weeks, the infant approaches a toy most frequently with both hands. And by 7 months, infants use a bilateral approach for large objects and a unilateral approach for small objects. After 7 months, the infants begin to play with two toys at a time and can bang two objects together. By 9 months, what are known as complementary bimanual activities begin. One hand positions the object and the other manipulates part of it due to increasing control of the radial digits and ability to grade supination and pronation as the object moves from hand to hand. By 11 months, the infants can move both hands in complementary directions, whereas a 7-month-old infant can move their hands only in the same direction. From 12 to 24 months, the infant develops greater control of bimanual skills with increasing complexity and integration of motor patterns. Speed, accuracy, and dexterity increase. Apart from these three major motor skill development categories in the hand, there is yet another category called the pencil grip. How the child holds the pencil at different stages of life is very characteristic. By around 12 to 15 months, what is known as a palmar supinate grasp is seen. The pencil is held in a palmar grasp and the hand is usually supinated. By 2 to 3 years, the infants have a digital pronated grasp. That is, now the digital grasp has begun with the fingers being involved and the hand also gets pronated. By 3 to 4 years, what is known as the quadrupod grasp is seen. That is, 4 fingers are involved or sometimes even 5 fingers are involved, including the thumb, in holding the pencil. Then is seen the static tripod grasp, that is holding the pencil between the thumb, index and middle fingers. It is only by 5 to 6 years of age that the dynamic tripod grasp is seen, in which the movements can occur within the fingers involved in the tripod grasp. In studying the normal growing hand after birth, we have seen so far the different aspects of growth of the hand as far as the motor skills are concerned, and we have also understood why we should know about all this. After all, our responsibility is to make sure that these motor skills develop to their fullest so that the complete potential can be achieved. And in our surgical maneuvers, we must make sure that this progression of the natural process of growth and maturation of the motor skills in the hand must be preserved at all costs. I hope you liked the video. I enjoyed making it. Please do click on the shown links to see more about the embryology and the classification of congenital hand differences. And do not forget to subscribe to stay connected with the latest in learning hand surgery, plastic surgery, trauma surgery and ethics. Vanakkam.